This is going to be the last video for the Unit 2 lab material, and it is going to focus on the latex agglutination test and the Kirby Bauer test. So the latex agglutination test is used in lab to determine what surface antigens some of our streptococci have. And we use the knowledge that we have about the antigens on these organisms to put them into different Lance field groups. So an organism that has antigen A belongs to Lance field group A. If the streptococci has antigen B, it belongs to group B, and so on and so forth. And there are actually 20 different groups based on various characteristics of the organism. Now, for this test, we're only concerned about which antigen the organism has. So Streptococcus pyogenes has antigen A because it belongs to group A. But it is important to know that all the streptococci that belong to group A have other things in common as well. For instance, a lot of them are beta hemolytic. So there's other similarities between these organisms, but we're only concerned about the antigen on their surface. Now, some of the streptococci don't have any antigens on their surface, and therefore they don't belong to a Lance field group. So how does this test actually work? Well, what we do is we use latex beads and we cover them in a specific antibody, because remember, an antibody reacts with only one specific antigen. So if we cover the latex beads with antibody A, they're only going to bind with antigen A, and that's it. And when antibody A and antigen A are mixed together, you're going to see agglutination. Remember, that's when, as you can see in this picture, the multiple antibodies are binding to the epitopes on a specific antigen. And so it kind of brings all the organisms in close proximity to one another. So it causes that clumping or agglutination. So that's where it gets its name, this test, latex agglutination. Latex beads covered with antibody result in agglutination or clumping when the antigen is present. Now for y'all, I always want you to use science terms, okay? So we're gonna use agglutination is going to be your observation, or no agglutination, okay? I use clumping and clotting, the words like that, just to kind of help you understand what the science term agglutination means, but I always want y'all to use the science terms. So this test used to be how we did the strep test in order to identify different groups, or like if we had a streptococci organism and we needed to know what group it belonged to, we could do this. But nowadays we actually use a more sophisticated, accurate test that's a lateral flow test. So we don't actually use this latex agglutination strep test anymore. So in lab, what we would be doing is you would get this strip. It's like a cardboard rectangle, and you would take an organism like Streptococcus pyogenes, and we use it in a liquid form. And so you would put a, 1 or 2 drops of the Streptococcus pyogenes culture in circle 1. You'd put a couple more drops in circle 2. And then what you do is you would add, for instance, to circle 2, because it's positive in this picture, you would add the anti-A serum. And the anti-A serum has antibody A. Okay, and then you would use anti-B serum, in this case, in circle number 1, okay? And it doesn't matter which circle you put each one in, but because Streptococcus pyogenes is in group A, I need the anti-A serum to give us a positive result, just to align with this picture. So that's why I put anti-A serum in circle 2, because as you see, if you compare the results of this test, you can see that circle 2 is positive, okay, because you can see that clumping together. Okay, see how it looks kind of spotty, right, because clumping has occurred, okay? But if I put anti-B serum in circle 1, that's going to give us a negative result because Streptococcus pyogenes doesn't have antigen B. So make sure you take a look, really compare what you see in circle 1 and circle 2 to make sure you understand what agglutination looks like. Okay, so again, observation is about agglutination or lack of agglutination. Your results should always be either positive or negative, with the exception being with blood agar plates, because there's actually 3 potential outcomes for that test. Most other tests, there's only 2 outcomes, yes or no. And in science world, that's positive or negative. And so yeah, we did this in lab looking at just a couple different organisms so that we could visualize which antigen that particular organism has. All right, the next test, pardon the scrolling, is going to be the Kirby-Bauer test. And so I'm afraid the pictures on this slide are a little bit misleading, because in lab, we're trying to look at an organism that is resistant to an antibiotic and an organism that is susceptible to an antibiotic. And so in lab, we actually divided a blood agar plate in half, put one organism on the top, a different organism on the bottom, and we added a bacitracin soaked disc. Bacitracin is an antibiotic to both organisms, which is what you see here. Okay, and I don't know, actually, do I know? No. Okay, on this picture, they don't tell us, what the top organism is and what the bottom organism is, but they are 2 separate or 2 different organisms, okay? And they each have the same antibiotic disc, because what the point of this Kirby-Bauer test is to determine which antimicrobial a specific organism is susceptible to. Okay, so normally in a real world setting, you would completely cover a blood agar plate with a single bacterial organism. And then what you would do is you add these little discs here, and each disc has been soaked in a specific antibiotic. So you would actually use multiple discs, each one soaked in a different antibiotic, so that you could then incubate the plate, and within 24 hours, you would know which antimicrobial is going to be an effective, choice for your patient. Okay. So again, normally, let me see, I'm trying to draw here. Here would be the plate. Sorry, pretend I can actually draw in a circle. And what you would do is you would, again, put a lawn of bacteria. Now it's acting funny. Sorry, here we go. So you would completely cover this plate, and I'm using my mouse here, so I'm really sorry that it's not colored very well and I'm going outside of the lines, but you create a lawn. So remember, with a lawn, you're completely covering that surface of the agar plate. Then what you would do, I'm going to switch to a highlighter because that might be easier. Then what you would do, so maybe this is E. coli. Maybe you think your patient has, well, let's use Staphylococcus aureus, because we know that one's becoming resistant to a lot of things. So you would completely cover this blood agar plate with Staphylococcus aureus, and then you would put a disc here that maybe has tetracycline on it. You'd put a different disc over here, maybe that has erythromycin. This other disc would have vancomycin, so on and so forth. And so you can actually test multiple antimicrobials and then look at how the bacteria, Staphylococcus aureus, grows in the presence of that antimicrobial. And what you're looking for is visible on this slide, okay? So if you look at this top bacteria, do you see how where that antimicrobial disc is? Do you see how the bacteria, it grew right up against it, right? You can easily see bacterial growth all around this disc. So we would say this organism is resistant to this antimicrobial because it didn't affect the bacterial growth at all, right? It's almost like the bacteria was kind of laughing at it, like, ha, 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 you tried to slow me down, but you couldn't, right? But if you look on the bottom, you see how there's this very clear zone around that antibiotic disc that meant that the organism could not grow in the presence of this antibiotic. Okay, so we call that clear zone, we call it a zone of inhibition. Okay, so in this case, we would say that the bacteria is susceptible to this antibiotic. So this antibiotic would be a potentially effective treatment option for your patient. Okay, so again, the goal is to see which antimicrobial will be effective for a very specific organism. Okay, so with the lab, we're deviating a little bit from what would normally happen to show you that different organisms react differently to the same antibiotic. Okay, but please know the normal purpose of this test is to have a single organism and determine the effectiveness of multiple antibiotics. So here with bacitracin, in this case, the two discs were soaked in bacitracin, and then you can see this top organism is resistant because it grew up against that disc, and the bottom organism is susceptible. And then here with optoshin, okay, same thing. You're seeing one that is susceptible because it's got this nice zone of inhibition down here. I just call it ZOI, zone of inhibition. But on the right, the organism grew right up against that disc. So this organism is resistant to it. Okay. All right, y'all, let me know if you have any questions.